Hey everyone, I'm Tanya Hansen and welcome back to the channel. Today, we're diving into some high-level infection control clinical judgment questions, the kind that really test how you think as a nurse, not just what you memorize. These are NGN-style, real-world scenarios designed to challenge your prioritization, patient safety decisions, and critical thinking skills. So, grab your notebook, pause when needed, and let's see if you can think like a safe, confident RN. Let's get started. Question 1. A nurse is caring for a client with suspected pulmonary tuberculosis. Which action should the nurse implement first? A. Apply a surgical mask to the client and place in a negative pressure room. B. Initiate airborne precautions immediately. C. Wear sterile gloves before entering the room. D. Obtain a sputum culture before isolation. Answer B. Initiate airborne precautions immediately. Rationale. Tuberculosis is transmitted via airborne particles. The priority is to initiate airborne precautions immediately to prevent transmission. While placing the client in a negative pressure room is necessary, airborne precautions include that action and use of N95 respirators. Wearing sterile gloves is not the priority, and sputum collection should not delay isolation. Question 2. Which actions should the nurse take to break the chain of infection? Select all that apply. A. Perform hand hygiene before and after client contact. B. Use appropriate personal protective equipment. C. Reuse single-use syringes if cleaned. D. Properly dispose of contaminated materials. Answer. A. Perform hand hygiene before and after client contact. B. Use appropriate personal protective equipment. D. Properly dispose of contaminated materials. Rationale. Breaking the chain of infection involves interrupting transmission routes. Hand hygiene, PPE use, and proper disposal prevent spread. Reusing single-use syringes is unsafe and violates infection control standards. Question 3. A nurse prepares to insert a urinary catheter. Which technique is most important to prevent infection? A. Clean technique. B. Medical asepsis. C. Surgical asepsis. D. Standard precautions only. Answer. C. Surgical asepsis. Rationale. Urinary catheter insertion requires sterile or surgical asepsis technique to prevent introduction of microorganisms into the bladder. Clean technique and standard precautions alone are insufficient for invasive procedures. Question 4. The nurse accidentally sustains a needle stick injury. What is the nurse's priority action? A. Document the incident at the end of the shift. B. Immediately wash the area with soap and water. C. Apply a sterile dressing only. D. Wait for symptoms before reporting. Answer. B. Immediately wash the area with soap and water. Rationale. Immediate cleansing reduces pathogen exposure. Reporting and documentation must follow promptly. Delaying action increases infection risk. Simply applying a dressing or waiting for symptoms is inappropriate. Question 5. A client with Clostridium difficile infection is admitted. Which precaution is required? A. Droplet precautions. B. Airborne precautions. C. Contact precautions with soap and water hand hygiene. D. Protective isolation. Answer. C. Contact precautions with soap and water hand hygiene. Rationale. C. difficile requires contact precautions. Alcohol-based sanitizer is ineffective against spores. Soap and water is required. Airborne and droplet precautions are not indicated. Protective isolation protects immunocompromised clients, not those infected. Question 6. True or false? Alcohol-based hand sanitizer is effective against all microorganisms, including spores. A. True. B. False. Answer. B. False. Rationale. Alcohol-based sanitizers are not effective against spore-forming organisms such as C. difficile. Soap and water must be used in these cases. Question 7. A nurse is caring for a client on droplet precautions. Which PPE is required when entering the room? A. N95 respirator. B. Surgical mask. C. Sterile gloves only. D. Powered air purifying respirator. Answer: B. Surgical mask. Rationale: droplet precautions require a surgical mask when within 3 to 6 feet of the client. N95 respirators are used for airborne precautions. Gloves alone are insufficient. Question 8. Yes or no? Should a nurse recap a used needle to prevent accidental injury before disposal? A. Yes. B. No. Answer: B. No. Rationale: recapping needles increases risk of needle stick injuries. Used sharps must be disposed of immediately in approved sharps containers without recapping. Question 9. A nurse notes a break in sterile technique during a dressing change. What is the best action? A. Continue if contamination seems minimal. B. Stop and restart the procedure with new sterile supplies. C. Apply extra antiseptic solution. D. Ask another nurse to observe only. Answer: B. Stop and restart the procedure with new sterile supplies. Rationale: any break in sterile technique contaminates the field. The nurse must stop and restart to maintain surgical asepsis. Continuing or adding antiseptic does not restore sterility. Question 10. Which clients should be prioritized for a private room assignment? Select all that apply. A. Client with measles. B. Client with neutropenia. C. Client with controlled hypertension. D. Client with active MRSA wound drainage. Answer: A. Client with measles. B. Client with neutropenia. D. Client with active MRSA wound drainage. Rationale: measles requires airborne precautions and a negative pressure room. Neutropenic clients require protective isolation. Clients with active MRSA drainage require contact precautions and often private placement. Controlled hypertension does not require isolation. Question 11. The nurse receives report on 4 clients. Which client should be assessed first to prevent rapid infection transmission? A. Client with influenza coughing without a mask in a semi-private room. B. Client with the healed MRSA wound on contact precautions. C. Client receiving IV antibiotics for cellulitis. D. Client with a urinary catheter for 2 days. Answer: A. Client with influenza coughing without a mask in a semi-private room. Rationale: influenza spreads via droplets. An unmasked coughing client in a shared room poses immediate transmission risk. The nurse must prioritize containment to protect others. The other clients do not present immediate widespread transmission risk. Question 12. A nurse prepares to care for a client with suspected meningococcal meningitis. Which actions should the nurse implement? Select all that apply. A. Initiate droplet precautions immediately. B. Wear a surgical mask when within close range. C. Place the client in a negative pressure room. D. Ensure prophylactic antibiotics for exposed staff. Answer: A. Initiate droplet precautions immediately. B. Wear a surgical mask when within close range. D. Ensure prophylactic antibiotics for exposed staff. Rationale: meningococcal meningitis requires droplet precautions and close contact mask use. Exposed healthcare workers require prophylaxis. A negative pressure room is for airborne diseases, not droplet infections. Question 13. A sterile field becomes wet during a central line dressing change. What is the nurse's best action? A. Consider the field sterile if only slightly damp. B. Dry the area with sterile gauze. C. Discard supplies and prepare a new sterile field. D. Continue quickly to finish the procedure. Answer: C. Discard supplies and prepare a new sterile field. Rationale: Moisture allows microorganisms to travel via capillary action, contaminating the sterile field. Any wet contamination requires full replacement. Continuing increases bloodstream infection risk. Question 14. True or false? A nurse may remove an N95 respirator immediately after leaving an airborne isolation room without performing hand hygiene first. A. True. B. False. Answer: B. False. Rationale: hand hygiene must be performed after removing PPE, including respirators, to prevent contamination. Proper sequence reduces self-contamination risk. Question 15. The infection prevention nurse notes increased central line-associated bloodstream infections, CLABSIs. Which intervention is most evidence-based? A. Increase routine antibiotic prophylaxis for all clients. B. Implement a central line insertion checklist and sterile bundle compliance. C. Shorten visiting hours. D. Culture all IV fluids before use. Answer: B. Implement a central line insertion checklist and sterile bundle compliance. Rationale: evidence-based bundles, hand hygiene, maximal barrier precautions, chlorhexidine prep, daily review of line necessity significantly reduce CLABSIs. Routine antibiotics increase resistance and are not recommended. Question 16. A nurse is floating to a new unit and is unsure about isolation signage. What is the safest action? A. Enter the room and ask the client. B. Ask the charge nurse before entering. C. Proceed without PPE if unsure. D. Wait until another nurse exits. Answer: B. Ask the charge nurse before entering. Rationale: when uncertain, clarify before exposure. Entering without proper PPE risks transmission. Infection control requires proactive communication. Question 17. Yes or no? Should a nurse use alcohol-based hand sanitizer after removing gloves when caring for a client with suspected Clostridium difficile infection? A. Yes. B. No. Answer: B. No. Rationale: Clostridium difficile spores are resistant to alcohol. Hand washing with soap and water is required after glove removal. Question 18. A post-operative client develops a fever 24 hours after surgery. Which nursing action demonstrates best clinical judgment related to infection prevention? A. Immediately start broad-spectrum antibiotics. B. Assess surgical site and review WBC trends before notifying provider. C. Remove all invasive devices immediately. D. Document and reassess in 8 hours. Answer: B. Assess surgical site and review WBC trends before notifying provider. Rationale: clinical judgment requires assessment before action. Fever may be inflammatory or infectious. Gathering data, site, labs, symptoms supports evidence-based provider communication. Question 19. Which practices increase the risk of ventilator-associated pneumonia, VAP? Select all that apply. A. Keeping the head of bed flat. B. Performing oral care with chlorhexidine. C. Interrupting sedation daily without assessment. D. Failing to perform hand hygiene before suctioning. Answer: A. Keeping the head of bed flat. C. Interrupting sedation daily without assessment. D. Failing to perform hand hygiene before suctioning. Rationale: supine positioning increases aspiration risk. Inappropriate sedation interruption without assessment can destabilize airway management. Poor hand hygiene increases pathogen introduction. Chlorhexidine oral care reduces VAP risk. Question 20. A nurse discovers that sterile supplies were stored below a sink in a procedure room. What is the most appropriate action? A. Use the supplies if packaging is intact. B. Relocate supplies and report storage concern to management. C. Wipe outer packaging with disinfectant. D. Use supplies for non-invasive procedures only. Answer B. Relocate supplies and report storage concern to management. Rationale: moisture exposure under sinks increases contamination risk. Supplies should be stored in clean, dry areas. Reporting promotes system-level infection prevention and risk management. Question 21. The nurse is caring for 4 clients during a norovirus outbreak on the unit. Which client should the nurse assess first to prevent rapid outbreak escalation? A. Client with new onset vomiting and shared bathroom access. B. Clients with controlled diabetes awaiting discharge. C. Client receiving oral antibiotics for UTI. D. Clients with chronic COPD on oxygen. Answer A. Clients with new onset vomiting and shared bathroom access. Rationale: norovirus spreads rapidly through contact and contaminated surfaces. Asymptomatic clients sharing bathroom facilities presents immediate outbreak risk. Early isolation prevents widespread transmission. The other clients are stable and do not pose immediate transmission risk. Question 22. A client with neutropenia, ANC 400, develops a temperature of 38.3 degrees Celsius, 101 degrees Fahrenheit. What is the nurse's priority action? A. Administer acetaminophen and reassess. B. Obtain blood cultures and notify the provider immediately. C. Place the client on droplet precautions. D. Encourage oral fluids only. Answer B. Obtain blood cultures and notify the provider immediately. Rationale: neutropenic fever is a medical emergency. Immediate cultures and provider notification allow rapid initiation of broad-spectrum antibiotics. Delays increase sepsis risk. Droplet precautions are not indicated unless respiratory symptoms exist. Question 23. Case study. A client admitted with suspected measles is placed in a private room. The nurse notes the door frequently opening and staff entering without respirators. What is the best nursing action? A. Close the door and continue care. B. Report non-compliance and reinforce airborne precaution education immediately. C. Place a surgical mask on the client only. D. Document observations at end of shift. Answer B. Report non-compliance and reinforce airborne precaution education immediately. Rationale: measles requires airborne precautions with strict N95 use and negative pressure rooms. Non-compliance creates high transmission risk. Immediate intervention protects staff and clients. Surgical masks alone are insufficient for airborne pathogens. Question 24. True or false? If gloves were worn during wound care, hand hygiene is not required afterward. A. True. B. False. Answer B. False. Rationale: gloves may have micro tears or contamination during removal. Hand hygiene is always required after glove removal to prevent cross-contamination. Question 25. The nurse prepares medications for multiple clients simultaneously in a central medication room. Which practice poses the highest infection risk? A. Using separate medication cups. B. Performing hand hygiene between clients. C. Preparing IV antibiotics at a cluttered sink area. D. Labeling syringes immediately after preparation. Answer C. Preparing IV antibiotics at a cluttered sink area. Rationale: medication preparation near sinks increase contamination risk due to splash and moisture exposure. Clean, designated areas must be used. The other options demonstrate safe practice. Question 26. Case study. A post-operative client with a central line develops redness and purulent drainage at the insertion site. What should the nurse do first? A. Remove the central line immediately. B. Obtain a culture of the drainage and notify the provider. C. Apply topical antibiotic ointment. D. Flush the line to ensure patency. Answer: B. Obtain a culture of the drainage and notify the provider. Rationale: signs suggest catheter-leaded infection. Culturing before antibiotics ensures accurate identification. Removal may be necessary, but requires provider order. Flushing could introduce pathogens into the bloodstream. Question 27. Which actions are appropriate when discontinuing airborne precautions for a client with active tuberculosis? Select all that apply. A. Confirm 3 consecutive negative sputum smears. B. Verify clinical improvement. C. Stop precautions once fever subsides. D. Collaborate with infection control team. Answer: A. Confirm 3 consecutive negative sputum smears. B. Verify clinical improvement. D. Collaborate with infection control team. Rationale: airborne precautions discontinue only after confirmed negative sputum results, symptom improvement, and interdisciplinary clearance. Fever resolution alone is insufficient. Question 28. Yes or no? Should a nurse cohort 2 clients with the same multi-drug-resistant organism in the same room when private rooms are not available? A. Yes. B. No. Answer: A. Yes. Rationale: cohorting clients with the same confirmed organism is acceptable when infection control guidelines are strictly followed. Question 29. Case study. During a sterile surgical procedure, the circulating nurse observes the scrub nurse reach below waist level with sterile gloves. What is the best action? A. Ignore if gloves appear clean. B. Immediately stop the procedure and replace contaminated items. C. Apply additional sterile drape over gloves. D. Continue and monitor for infection signs later. Answer: B. Immediately stop the procedure and replace contaminated items. Rationale: anything below waist level is considered contaminated in sterile technique. Immediate correction prevents surgical site infection. Delayed action compromises patient safety. Question 30. The nurse manager reviews infection data showing increased catheter-associated urinary tract infections, or CAUTIs. Which strategy demonstrates highest level prevention? A. Schedule routine catheter changes every 3 days. B. Implement nurse-driven protocol for early catheter removal. C. Increase prophylactic antibiotic use. D. Irrigate catheters daily with antiseptic solution. Answer: B. Implement nurse-driven protocol for early catheter removal. Rationale: the most effective CAUTI prevention strategy is minimizing catheter duration. Nurse-driven removal protocols are evidence-based and reduce infection rates. Routine changes, irrigation, and prophylactic antibiotics are not recommended. Question 31. The nurse is assigned to 4 clients. Which client should be placed in a negative pressure room immediately? A. Client with suspected varicella and diffuse vesicular rash. B. Client with streptococcal pharyngitis. C. Client with RSV bronchiolitis. D. Client with bacterial pneumonia on antibiotics for 48 hours. Answer: A. Client with suspected varicella and diffuse vesicular rash. Rationale: Step 1. Identify transmission route. Varicella spreads via airborne particles. Step 2. Airborne diseases require negative pressure rooms and N95 respirators. Step 3. Immediate placement prevents widespread transmission. Streptococcal pharyngitis requires droplet precautions. RSV requires contact precautions. Bacterial pneumonia after 48 hours of antibiotics typically requires standard precautions. Question 32. Case study. A client with septic shock is receiving broad-spectrum antibiotics. Blood cultures were not obtained prior to antibiotic administration. What is the priority nursing implication? A. No further action is needed. B. Obtain cultures immediately, even after antibiotics. C. Stop antibiotics until cultures are drawn. D. Document and reassess in 24 hours. Answer B. Obtain cultures immediately, even after antibiotics. Rationale. Step 1. Cultures ideally precede antibiotics, but treatment should not be delayed in sepsis. Step 2. If missed, cultures must still be obtained promptly. Step 3. Stopping antibiotics would worsen shock. Step 4. Waiting delays identification of pathogen and targeted therapy. Question 35. A nurse notes that a colleague removes PPE in the incorrect order after caring for a client on contact precautions. What is the most appropriate action? A. Ignore if no contamination is visible. B. Report immediately to management without discussion. C. Provide immediate constructive feedback and reinforce correct sequence. D. Document the incident in the chart. Answer C. Provide immediate constructive feedback and reinforce correct sequence. Rationale. Step 1. Infection prevention is a team responsibility. Step 2. Immediate correction prevents self-contamination. Step 3. Professional communication supports safety culture. Ignoring increases risk. Reporting without discussion may not promote learning unless pattern continues. Question 34. True or false? A sterile field is considered contaminated if the nurse turns their back to it briefly. A. True. B. False. Answer A. True. Rationale. Step 1. Sterile fields must remain in constant view. Step 2. Turning away means sterility cannot be guaranteed. Step 3. When sterility is uncertain, it is considered contaminated. Patient safety requires restarting the setup. Question 35. Case study. A client with influenza is admitted during peak season. The unit is full and only a semi-private room is available. The roommate is immunocompromised. What is the best nursing action? A. Place both clients together with curtains drawn. B. Transfer the immunocompromised client elsewhere and initiate droplet precautions. C. Use standard precautions only. D. Delay admission until private room opens. Answer B. Transfer the immunocompromised client elsewhere and initiate droplet precautions. Rationale. Step 1. Influenza spreads via droplets. Step 2. Immunocompromised clients are at high risk for severe complications. Step 3. Protect the vulnerable client first. Ethical principle, non-maleficence. Step 4. Delaying admission compromises care. Question 36. Which interventions reduce surgical site infections? Select all that apply. A. Administer prophylactic antibiotics within 60 minutes before incision. B. Maintain perioperative normothermia. C. Shave surgical site with razor night before surgery. D. Perform proper surgical hand antisepsis. Answer A. Administer prophylactic antibiotics within 60 minutes before incision. B. Maintain perioperative normothermia. D. Perform proper surgical hand antisepsis. Rationale. Step 1. Evidence-based bundle includes timely antibiotics. Step 2. Normothermia improves immune function. Step 3. Surgical hand antisepsis reduces microbial load. Step 4. Razor shaving increases microabrasions and infection risk. Clippers are preferred. Question 37. A nurse prepares to insert an indwelling catheter in a client with urinary retention. Which action demonstrates highest level infection prevention? A. Apply sterile gloves only. B. Use sterile technique and ensure closed drainage system integrity. C. Irrigate catheter daily with antiseptic solution. D. Change catheter every 48 hours routinely. Answer B. Use sterile technique and ensure closed drainage system integrity. Rationale. Step 1. CAUTI prevention requires sterile insertion. Step 2. Maintaining a closed system prevents ascendant infection. Step 3. Routine irrigation and frequent changes increase infection risk. Step 4. Evidence-based practice emphasizes minimal manipulation. Question 38. Yes or no? Should reusable medical equipment be disinfected between clients even if no visible soil is present? A. Yes. B. No. Answer A. Yes. Rationale. Step 1. Microorganisms may be present without visible contamination. Step 2. Standard precautions require cleaning between clients. Step 3. Prevents healthcare-associated infections. Question 39. Case study. During an outbreak investigation, multiple clients develop infections linked to a shared glucometer. What is the priority corrective measure? A. Assign one glucometer per client and disinfect after each use. B. Increase antibiotic therapy for affected clients. C. Test staff for infection. D. Discontinue glucose monitoring. Answer A. Assign one glucometer per client and disinfect after each use. Rationale. Step 1. Identify transmission source, shared equipment. Step 2. Stop transmission immediately by dedicating equipment. Step 3. Disinfection between uses aligns with CDC standards. Antibiotics treat infection but do not stop spread. Question 40. Case study. A nurse enters a room of a client with active tuberculosis and realizes midway through care that the N95 respirator seal was not checked. What is the priority action after exiting the room? A. Do nothing if exposure time was short. B. Report exposure according to occupational health protocol. C. Re-enter room with correct seal and complete care. D. Wait for TB skin test results before reporting. Answer B. Report exposure according to occupational health protocol. Rationale. Step 1. Airborne TB requires properly fitted N95 respirator. Step 2. Improper seal may constitute exposure. Step 3. Follow institutional exposure protocol immediately, risk management and legal responsibility. Step 4. Early reporting ensures baseline testing and prophylaxis if needed. Wow, you've just completed 40 high-level infection control questions. If you made it all the way to the end, that already tells me you're serious about passing the NCLEX and becoming a safe, confident nurse. Remember, infection control isn't just about PPE and isolation signs. It's about critical thinking, prioritization, patient safety, and protecting entire communities. One mistake can cause an outbreak. One correct decision can save lives. If this challenged you, that's a good sign. Growth happens when it's hard. Comment below your score out of 40 and tell me which question made you think the most. Don't forget to like, subscribe, and share this with a nosing friend who needs serious clinical judgment practice. I'm Tanya Hansen, and I'll see you in the next NCLEX challenge. Keep studying, stay sharp, and think like a nurse.